All right. So food allergies today. Food allergies, food intolerances, and then it looks at, phenylketonuria, which is ultimately going to be one of these intolerances that can get really nasty if for some reason you don't get it properly diagnosed, but we'll get into that here just briefly. Being able to describe the difference between a food allergy and a food intolerance would be something that would maybe behoove you. I don't know if it's necessarily going to be a short answer question or essay question, but there could be a handful of multiple choice type questions, maybe asking the differences between the two, or looking at something, giving you an example of it. What is this? Is this a food allergy or is this a food intolerance? And the big difference between these two things is what I have underlined right here. An inflammatory response. That is the difference between the two. One causes the immune system to react. The food allergy, a food intolerance, you do not see inflammation. You do not see an inflammatory response. Okay? When we have an inflammatory response, white blood cells, the body is trying to mount something to try to kill off a quote unquote foreign invader. All right, that's the difference between the two. And if you have allergies, these are harmless substances, but for whatever reason, our bodies have an exaggerated immune response to them to try to mount an immune response to get rid of that foreign invader. If you have allergies to what's going on outside, you go outside, whoom, you get swelling and inflammation. All right, that's an immune response. And that's what we see with a food allergy. With a food allergy, it's not just going outside, but it's usually eating generally a protein. That's the most common type of allergen when it comes to nutrition and food that we'll be talking about here. When the individual does have an allergy to a food, to a specific type of food type, specific protein, the food does not undergo complete digestion. Okay. And so it makes it really difficult for the body. The body still tries to bring it across the cellular intestinal cell surface there between that and the lumen of the digestive tract. When that happens, we get some swelling and inflammation. Okay. And if I was to draw some cells stuck together representing your intestinal lining, let's just say, okay, you'll notice that, they adhere to one another. When we have an immune response, there's swelling and inflammation. What we see in that digestive tract, leaky gut syndrome, you probably heard that one before, we see a space that all of a sudden occurs, and the cells don't necessarily change size, they get swollen, okay? And when they get swollen, these tight junctions that exist here between these two aren't so tight anymore. And now stuff can get in between these cells. And when that happens, we get even more inflammation. More fluid is coming across into the tissue. When it comes to the digestive tract, this can lead to a whole host of problems. Okay? You're not absorbing properly. You're absorbing way too dang much as well. You haven't broken it down to their requisite monomers, okay? Individual amino acids, individual glucose molecules, fatty acids and glycerol. Okay? You haven't broken them down enough. Okay? And so you get all of this stuff coming across. Can the cells bring those in? Can they be transported easily? No. And you get an even greater immune response. What are some of the signs and symptoms? The signs and symptoms of a food allergy and a food intolerance are kind of similar. I've highlighted kind of 4 big ones here when it comes to a food allergy. These are things that you will definitely see when someone has a food allergy. When someone has a food intolerance, you may see them as well. There's a lot of factors that depends on. But when it comes to a true allergy, you will see swollen lips. They're putting the food in their mouth. Their lips are touching it. If you take an allergen and touch the skin, it's going to get red and irritated. There's the immune response. All right. So the first thing you're going to see on this individual, well, at least the individual will feel anyway, is going to feel tingly, itchy lips. All right. For us, they're going to look swollen. For the individual, they may not know it right away, especially if they're a child. They're definitely not going to understand that sensation at all. What you are going to see first, more than anything, is hives. Okay. And these are raised red bumps. Okay. They can be splotchy all over the skin. They can be concentrated in a specific area. Again, an immune response. This is a pretty severe immune response. Immediately, it goes to difficulty swallowing. Everything's swelling and inflaming. You're taking that allergen and now you're swallowing it down, going down the tray or down the pharynx, down the esophagus. Everything it touches is going to be swollen and inflamed. Makes it very difficult to swallow. Okay? If you have a child and you don't know about a food allergy, hives is going to scare the bejesus out of them. Okay? We've fed my youngest, walnuts before. He's had nuts before. Had no big issue with it. One night he had just a handful of them at dinner time and started to complain a little bit about his lips itching a little bit. They weren't really swollen. And then all of a sudden he started getting splotches on his face. And then the whole side of his face was swollen, like just half of his face was swollen. It was crazy. Very difficult swallowing. He didn't have trouble breathing real bad at all. Didn't really have any wheezing, but it went into some discomfort in the abdomen. And then hoo-ha, everything that he ate for dinner came on back up. The hives stayed for a while. Gave some children Benadryl. Stayed with him for the vast majority of the night to make sure he didn't stop breathing. And he was perfectly fine. But especially with children, man, they are going to wet themselves. They're going to be freaking out when they see themselves. You just got to try and stay calm. Okay? Because if they pick up on you wetting your pants, they're going to freak out even more. And that can even exacerbate a stress response and exacerbate that immune response happening. Once they get rid of it, the emetic, the vomiting, or the diarrhea, probably both will happen. Hopefully you'll be lucky and won't happen at the same time. But once they get that crap up and out of them, after about 6 to 8 hours, especially if you give them some children Benadryl, they generally, recover that next day and they look fine. It can get to severe. And in some individuals, they can have a severe drop in blood pressure, which can ultimately be fatal in some individuals if they have a severe food allergen. And that's referred to as anaphylaxis. And really the only thing that can help to prevent that extreme drop in pressure is the EpiPen. It's epinephrine, it causes vasoconstriction, helps to raise the blood pressure back up so, it doesn't drop into fatal levels. What are some of the food allergens? We primarily know them, okay? Shellfish, tree nuts, those are some of the biggies, okay? But there are some individuals who are allergic to peanuts. And, if something is made with peanuts, has peanut products in it, made in a facility where peanuts are processed and the dust can get in the air and fall on those foods, it will tell you that it is made in a facility where peanuts are processed. Okay? Those are probably the big three. You may not develop them right away. Some people have them right out the womb. Some people it takes 10 years. Some people it takes 20 years for it to manifest. Okay? No rhyme or reason as to why and when it happens. Okay? Could be the onslaught of hormones for some. I know several girls who have shellfish allergies, and those didn't start until about when they started puberty. That's anecdotal to say the least. They don't know why some of these develop. as early or as late as they do. But all of these protein, right? Gluten, protein, soybeans, protein, tree nuts, protein, all of this is protein. Okay? Some people have a pretty severe allergy to albumin in eggs. That's why it's up there. Cow's milk, another fairly common one as well. Sometimes cow's milk gets thrown in here. Sometimes it gets thrown in food intolerance. So it can kind of go on both for some individuals. It was once thought that we need to not expose children until they are much older. Okay? Kind of not early school age, but 8 to 10 is what they were kind of thinking is, maybe we should wait and introduce some of these foods, nuts especially, until they are closer to their teen years. Research shows now that the earlier we can expose ourselves to these known food allergens, that the system won't freak out when we do introduce them. Right? I have a link to a study. I think it's to the American Academy of Pediatrics released there. They had a study. It was they're quoting a New England Journal of Medicine study, and it started introducing high-risk infants to peanuts or peanut butter. Inclusion of peanuts for high-risk infants beginning as young as 4 months of age. Okay, so that's when they started introducing this. These are families where there's a known food allergen in the family, so the likelihood of this child having a food allergy was pretty high. That's how they did this. They also started introducing eggs early as well, because you have to wait generally about a year, 8 to 12 months to start introducing eggs to a baby. And they started introducing those early as well. In the study, they found the risk of developing a peanut allergy dropped by 81% when parents introduced a peanut into a baby's diet and continued to feed peanut regularly for 5 years. And that was regularly as 3 times weekly. That's a pretty massive drop. And this was 2015 when the study came out. I think in 2016 is when the American Academy of Pediatrics changed their stance on it. Because prior to that, they were like, hands off, don't even get this food in the building with them. In the building. Insane. I had young kids at that time, and like you couldn't even bring like a peanut like thing into a classroom with a child who had a food allergy. They had their own table at lunch. They had their own cleaning supplies at that table, so it wouldn't get any cross-contamination. It is pretty crazy. Right? But here's a study, and because of that study, the American Academy of Pediatrics totally changed their stance on the process. So what I'm saying, if you have a child with a food allergy, go and talk with your pediatrician. Okay? You could probably start to introduce small amounts of the food allergy to try to get them to build up a tolerance to it, is ultimately what's happening here. The same thing happens with lactose. Okay, if you're lactose intolerant, you could take small little bits of lactose, small little bits of ice cream. Okay, that can build up your tolerance to that milk protein. Same thing here, just on a much more intense scale here. Because with these food allergies, if you've seen a child have one in a school, it's a scary situation for everybody involved. And there you go. If there is a known allergen in it, they have to label it. Okay? Whether it's phenylketonuria, soy, peanuts, whatever, they got to put it on their food label. Okay. If it's not on their food label, then you get a payday. There you go. Mazel tov. Food intolerance is a hell of a lot different than a food allergy. With a food intolerance, no immune response. It's just an unpleasant feeling, an upset stomach, gas. There you go. Those are generally the most common type of unpleasant physical reactions that you can get. Some people get diarrhea. Some people get vomiting, but you can see hives, difficulty swallowing, vomiting and diarrhea. Those are symptoms for a food allergy as well. That's why it's so difficult to distinguish between the two for the vast majority of people. But if they just have an upset stomach, not necessarily any severe vomiting or diarrhea, maybe the next day, maybe once, and then they're fine, that's a food intolerance. Just an unpleasant physical reaction. Some people may not get. Maybe bloating isn't unpleasant for you. I don't know why it would be, but unpleasant is very subjective. Okay, so this is going to be dependent upon the person. That's what I'm trying to say. What's unpleasant for some people don't really care about. It doesn't bother them. Some of the most common things, there's lactose. Okay, lactose intolerance. Okay, MSG for some individuals. Monosodium glutamate. Those are examples. Sulfites. Some sulfites you find in wine and some other products. They just cause an unpleasant characteristic, which is generally a runny nose. That's more of a nuisance. It's unpleasant, but same thing, tomato, right? But again, these things, lactose intolerance, no inflammatory response. Intestinal discomfort though. Probably a little bit of diarrhea for those individuals. MSG, you get some swelling and inflammation a little bit. Okay, mostly in the head, but in the gut a little bit later. Sulfites, the same thing, usually results in rhinitis, just a runny nose. Something that the book goes into a little bit, and I'll mention here just a little bit as well, is phenylketonuria, PKU. This is a genetic condition. Right? Phenylketonuria is when an individual cannot convert phenylalanine. Okay? You don't need to know that it can be converted into tyrosine. Just know what in the world a PKU individual cannot break down. They can't break down phenylalanine. And phenylalanine is just an amino acid, again, a protein, right? With this, when they can't break it down, it just accumulates within the fatty tissue of the body. Where's the fatty tissue, fatty tissue in the body located, you ask? Well, I mean, yeah, it's in our midsections, right? Glute, butt, thighs, triceps, all those fantastic places. But that's not what we're talking about. When we say it accumulates within the fat of the body, it accumulates within the fat that wraps around nerves, the fat within the brain. High amount of fat is within the brain. There's a little layer of fat that surrounds the vast majority of nerves. This helps to speed up nerve impulse conduction. If you have a big, thick nerve that's myelinated, wrapped in fat, the impulse travels around 600 miles per hour. If it's a really small nerve and it's not myelinated, doesn't have that fat around it, it travels about 2 miles an hour, which is still pretty fast in the body, going from your brain to your, to your hand. But 600 miles an hour is a hell of a lot faster than 2. This leads to an inability to properly get the nerve impulse from one location to the next, because it's messing up the fat. How is it messing up the fat? Is that phenylalanine supposed to be there? No, it's normally broken down and gotten rid of. But now it's accumulated within this fat. Something's different. The body senses it and it's like, okay, I'm going to go in there and fix that. And it can lead to some nerve damage. Right? So that's where you see some severe intellectual disability, brain damage, okay? And behavioral seizures. It can really affect anything where this PKU, this phenylalanine, is going to be found. Again, it's a genetic test. As soon as you go into your OB/GY, you do a test to see if you're truly pregnant. You probably already know, official diagnosis. And then they start taking oodles and oodles of blood. One of them is to run a number of genetic tests. Okay? And one of them is PKU. They do it in every state now, which wasn't the case in the early 2000s. I think Missouri and a handful of other ones didn't start doing it until somewhere around 2005. So this is something that every state screens for, because you can prevent the damage that PKU causes. Mother goes on a special diet. You just don't consume anything with phenylalanine. The baby goes on a special diet for the first several years of life. Okay? Obviously, in the beginning, they're breastfeeding. So for that first year, roughly, we don't have to worry about food. Right? Mom still does. But once you start introducing food to the infant, don't give them phenylalanine. Okay? If there is phenylalanine within it, PKU or phenylketourics will be written on the label. And that's when you know this amino acid is there and you can avoid that food type. Okay? And then I can't remember how many years you have to do that, 5, 6 years. I can't remember off the top of my head. Once you follow that diet, you can slowly start to release some of the restrictions until they get into, I think they're early teen years or something like that. I can't remember off the top of my head. Okay. And then obviously, if they are a woman, girl, becomes a woman, becomes pregnant, she'll need to follow the special diet and do it all over again.